Now, live from Whitney Media, 1460 WVOX, the Greenberg Report with Greenberg Town Supervisor Paul Feiner. You can join in the conversation at 914-636-0110. Now on 1460 WVOX, here's Greenberg Town Supervisor Paul Feiner.
Good morning, Westchester. I'm the Greenberg Town Supervisor, Paul Feiner, and we have a very interesting program today. We're going to be talking with Dean Ronnie Myers of Touro School, and we're going to talk about some exciting dental programs and services that Westchester residents could take advantage of. So, Dean Myers, thank you so much for joining us.
My pleasure.
Could you maybe tell us a little bit about Touro?
Sure. Touro College of Dental Medicine, which actually was founded in 2016. We matriculated our first class in July of 2016, is the first dental school to open in the state of New York in over 50 years, and actually the newest dental school to matriculate students of the 66 dental schools in the country. So we're quite young, but very exciting over the course of the last 4 or 5 years almost, in which we have developed a robust program which provides dental services actually for the population or the community of the Lower Hudson Valley. And we have a clinical facility which is second to none in providing care, and located in Hawthorne.
One of the interesting initiatives that you offer is a Kids Smile program. And you've also offered free dental care and do a lot with online educational activities reach. Would you be able to tell us a little bit about that?
Oh, absolutely. So the Give Kids a Smile program, shortened for GKAS, is a program that was actually developed many years ago, funded partially by Henry Schein and sponsored by the American Dental Association. And it's a program that's all over the country. When we opened our clinical facility back in February of 2018, we actually developed a program for Give Kids a Smile, in which we opened a facility for children to come on Give Kids a Smile Day that year, to have free dental checkups, cleanings, fluoride treatments, and education with their parents, oral hygiene education with their parents. It has actually grown in the last 3 years, in 2019 and 2020, in which we went from the initial year of only seeing about 20 children to last year seeing close to 100 children. This year, due to the pandemic, we took on a different focus. Since we couldn't have all the children come on any one day, we opened free dental care for children for the month of February for examinations, checkups, and cleanings. And we also produced several videos that were circulated to some of the school systems in Westchester to go over oral hygiene and also careers in oral health. So that was a major undertaking for this year. And next year we obviously hope for a big event for Give Kids a Smile Day in person. We also have a Smiles for Veterans program that we've run every year. And again, this year it took on a little different meaning because we couldn't have one day with everybody coming, but we had it again over the course of November, in which we offered free examinations and cleanings for veterans. It's online programs, given the pandemic. The educational program moved online back last March for our students, and slowly, beginning in June, we opened back up our clinical facility when the governor said dental care could open in June, and now we're back to seeing as many patients as we did before the pandemic.
That is great. If somebody is lower income and they can't afford a local dentist, does Touro students provide less expensive options for the general public during the year?
Yes. Well, our fees are generally somewhere in the neighborhood of 50% of the general dental population or community in Westchester and the lower Hudson Valley. Of course, that varies, but our fees are reduced. One of the reasons they're reduced is the care is provided by our dental students, third and fourth year dental students, under the strict supervision of licensed faculty members.
We have to take a break, and then we'll be back in a couple minutes, in about 5 minutes. Is that okay with you? I'm Paul Feiner, Greenberg Town Supervisor, interviewing Dr. Dean Ronnie Myers of Touro College of Dental Medicine, and they're located at New York Medical College. And we were talking just now about some of the inexpensive programs they offer the general public. So we'll be right back, and we'll continue our conversation. I'm Paul Feiner, Greenberg Town Supervisor.
Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Good morning, Westchester. I'm Paul Feiner. I'm the Greenberg Town Supervisor, and we are so fortunate to have a fantastic dental college, Touro College of Dental Medicine, and in our community. And Dr. Dean Ronnie Myers is speaking to us. And I was asking before the break about lower cost dental services. Dean Myers, do you feel that these costs also provide people with quality dental care? Today, will people get the same quality care at a college that they would get at a typical dental office?
Absolutely. I think that as I said just before break, the fees are less than in the public, but they're less in the public for two reasons. One is that the care is provided by dental students, and the time it takes the dental student to provide the care is longer than it would take in a private office. So essentially, you're paying, so to speak, with your time rather than your money. But the supervision, the second thing is the supervision is high quality with faculty, licensed faculty, who supervise every step of the way in things that are being done by the students. So at each step of the procedure, the faculty member is reviewing what the student does and critiquing and actually working with the student to provide the ultimately best care.
And are there usually longer lines if you have an appointment? I know at a regular dentist's office, if you have an 11 o'clock appointment, you'll be seen in like 10, 15 minutes or something around the 11 o'clock appointment. What about at a college?
No, we pride ourselves in trying to stay on time, just as you would in any dental office. And we put in many procedures to expedite people coming into the building and getting to their appointment with all the safety procedures in place to protect the safety of our patients for COVID and certainly seeing them on time.
If people want to give a ring and make an appointment, how do they do so?
914-594-2700.
I was looking at your website, and you had a very interesting program called Name That Injection. It's the game show initiative. Could you tell us a little bit about that?
Sure. Well, you can imagine in educating an oral health care provider is a 4-year period, first of all, so it's a long journey. And certainly every step of the way, you provide the educational environment in which they can learn things very well. So we've learned a lot during the pandemic of ways to engage students who are not necessarily on site. And certainly two of the ways to do that is by engaging them in activities such as the Name That Injection program. And it actually ties, the second part of that is it ties to when they do come on site to be able to actually perform injections on a simulator and mannequin before they get to the clinic. But the Name That Injection site was certainly the idea of Doctors Raquel Rozdolski and Dr. Howard Israel. Dr. Israel is an oral maxillofacial surgeon, and Dr. Rozdolski is a dental anesthesiologist. And they developed a game show in which students would actually be given a case. They would be sent out in virtual breakout rooms where they could discuss the anesthesia and the appropriate injection technique for providing anesthesia for the procedure. It was actually very unique, and I applaud them for it.
Right. You also have a very, very interesting program, a pre-dental program for undergraduate students. Could you tell us a little bit about that?
Sure. For one of the things that we feel very strongly about is exposing individuals both in high school, but certainly in undergraduate college to what it's like to be an oral health care provider and a dental student. Those individuals who are interested in actually going to dental school or going to hygiene school or just being in the oral health care team orientation. So what we've done is we've created a program. It's a week-long program for undergraduates, college undergraduate students who are interested in learning about dentistry, coming to spend a week at the Touro College of Dental Medicine and learning about dentistry, healthcare, learning about what a dental student goes through in their 4-year curriculum.
That is great. I was just thinking we have a community center in Greenberg, Theater Young Community Center, that serves mainly lower-income young people. And I was thinking of trying to create job readiness programs. Would this be something that possibly the college might be interested in, in working with us and, trying to mentor some young people so they could apply, so they could be prepared for the jobs that are really needed?
Yeah, very much so. We would really very much like to be involved in that. One of the things that I think is incumbent upon us in healthcare is to bring access. And one of the ways to bring access is to train as many people as we possibly can in all aspects of oral health care provision, whether it be dental assisting, whether it be dental hygiene, whether it be dental technology or technicians, laboratory technicians, or dentists. All of those things play into the oral health care team in providing care. And so, if we could certainly enlighten somebody or, set off the light bulb that gets them interested in becoming an oral health care team member, that would be absolutely fantastic.
That is so good. And so as a result of this interview, we might be able to provide young people with careers that really would be good. I could also, advise some of the local, clergy, schools, because I think we need to do more to prepare young people for jobs that are really needed. Is it hard if somebody graduates from your program to get a job?
Oh, no, it is not hard for somebody who graduates dental school to get a job. We have actually about 80% of our graduates don't go right into practice. They do residency programs, whether it be in general practice in a hospital setting or a federally qualified healthcare setting.
Right. We have to take one more break, and we'll be back in a couple minutes. Just a little shorter break. I'm Paul Feiner, Greenberg Town Supervisor.
Now, back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Good morning, Westchester. I'm Paul Feiner. I'm the Greenberg Town Supervisor, and I'm so pleased to have the opportunity to interview Dean Ronnie Myers of Touro College of Dental Medicine, which is located in Westchester. Dean Mars, is it difficult to get into dental college?
Yes, it is difficult to get into dental school. Right now, nationally, there are about 6,400 first-year slots in the 66 dental schools across the country. And for those 6,400 openings, there are about 12,000 applicants. So a little less than 2 to 1 as far as the applicant to the space available in dental school. So it is rather difficult to get in. If you go back to the mid-'70s, it was even more difficult. In the mid-'80s, it became less difficult. And now in the mid to 20,000s, like 2005 to now, it has increased again. And as I said, it's approximately 2 to 1.
Wow. And what about like just programs for dental hygienists? Is that tough to get into?
No, it's difficult, but it's a lot less difficult. I don't know the numbers off the top of my head for dental hygiene, and I know that there are certainly available spots for dental assisting programs, but again, I don't know the statistics on those.
And your college offers that also, right?
No, our college, the College of Dental Medicine currently only offers a dental degree. We do not have a degree dental hygiene. Or do we have a certificate or degree in dental assisting?
So your programs for undergraduate students and even high school students, or if we come up with a pre-dental program, say at a community center, really could give students a leg up because I guess if they start very early showing an interest, they may have the foundations that will enable them to get into dental school.
I think that the benefit of those programs that we were speaking about, the true benefit is introducing the concept that there's a broad range of oral health care or dental professions that are available. Certainly easier to get into, let's say, a dental assisting program or a dental hygiene program compared to a dental program. On the one hand. On the other hand, if there are many people who go to dental hygiene school and eventually say, gee, I'd like to go to dental school, or they become a dental assistant and they'd like to go to dental hygiene school. So I think it, as you just said, Paul, which is, I think, a good statement, is it introduces them to the potential of a professional career or a career in oral health, and so therefore they can plan for it. It's a sort of a mentoring program, right? In other words, it gets them exposed and tells them what the possibilities are and how they could go about doing it.
Right, and a dental hygienist or a dental assistant, if they have some years of practice, they'll be able to understand the curriculum better because they'll be much more familiar. It won't be totally new. So they probably would do better in school.
Absolutely.
How expensive is it, to go to medical college right now?
It's rather expensive. We are fortunate. Our tuition for the Touro College of Dental Medicine, compared to other private dental schools, is on the lower end. In fact, by survey of the 16 or 17 private dental schools, we're somewhere in the lower 15, 14 versus number one, right? That's one where you try not to be number one. The school that's charging the most tuition. So we as a private school are certainly lower than most all other private dental schools. There are many state schools throughout the country. New York has 2 state schools, one in Stony Brook and one in Buffalo. That their tuition is less for state residents, obviously. And, of course, there are many other state schools, Ohio State, Michigan, so on. So it is expensive. Dental education is probably one of the most expensive educations out there. And the average debt of a dental school graduate right now is approaching $300,000.
Well, so when we go to a dental office and we get a high bill, we should be more understanding.
I understand where you're coming from, but certainly it's true. It's expensive to go to dental school, and young dentists have lots of loans to pay back.
And after somebody's at graduate dental school, do they have to go for continuing education?
Yes. Every state is different in what the requirements are for licensure. The state of New York, I'm proud to say, requires every dental graduate to get a license in New York State has to do at least 1 year of postgraduate training. In all the other states, 49 other states, there are other ways to get a license. Some of them can get a license with a residency program, but in the state of New York, you can't graduate dental school and the next year get a license. You have to do a postgraduate training. As far as maintaining your educational level, you are required in maintaining your license to do a minimum of 60 hours of continuing education every 3 years to maintain your license.
That is so interesting. I'm learning a lot. I also had a question that I just thought of a couple seconds ago about technology and how has technology changed in the digital world for dentists?
It has been remarkable. It's a remarkable change. I think that most patients or most individuals listening to this conversation have probably experienced, digital radiology, right? Digital X-rays. That was really the first step in technology, bringing it to the dental environment. Are you there?
Yeah, I'm there.
Oh, okay.
Hello.
That was the first step in bringing technology to dental offices. It has expanded enormously over the last decade, in which now impressions of teeth, which used to be with, impression material. People probably remember having braces and impression materials or crowns with impression material. Now there are many dentists who use digital scanning. They can actually scan the teeth, and they can send the file to the laboratory, and then the laboratory can manufacture the crown or the bridge with milling machines instead of casting machines. So there has been a drastic increase in technology. Along with that is the design of prostheses that are done digitally. Implants now can be, planned surgically. They can be planned with software so that the surgery becomes safer, because you can now use a surgical guide to place the implant as opposed to not having something guiding the surgeon. So there are a tremendous number of technologies that have improved and assisted in the provision of care for dentists.
We have one final break, and we'll be back in a couple minutes with Dean Ronnie Myers of Touro College of Dental Medicine. So stay tuned. We'll be right back. I'm Paul Feiner, Greenberg Town Supervisor. Thank you.
WVOX. Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Good morning. I'm Paul Feiner. I'm the Greenberg Town Supervisor, and my guest today is Dean Ronnie Myers at Touro College of Dental Medicine. It's a really interesting program we have, and again, Dean Myers, could you tell us how people could take advantage of some of the programs that you offer the community, lower cost dental care? How do they contact you?
Sure. The easiest way to contact us is obviously by phone at 914-594-2700. You can go to our website and dental.touro.edu and get all the information you'd like. And those are the two easiest ways to get in touch with us.
What made you go into this field?
Personally, I guess that's a personal question.
Right.
So I'm fortunate enough that my father was a dentist, so I was exposed to dentistry very early in my life. And he had a home office, and so I got to spend much of my childhood seeing what dentistry was all about. And that's what started me on the journey. So it was, I guess, an easy journey for me.
That's great. And during the pandemic, how have students handled their education? How has it been different? Because, say in most colleges it's all virtual, and being a dentist is much more hands-on.
It's true. It's very difficult to teach somebody to do dental procedures without them actually doing it and treating patients. So I appreciate the question. It was a challenge, but I give full credit to the perseverance and the dedication of our faculty and our students who were remarkable during this whole period. Obviously, back in March, the beginning of March of 2020, when New Rochelle became the epicenter of the beginnings of the pandemic, we closed down essentially on March 19th. March 16th, sorry. And that's when our clinics closed. But through March 16th until June 16th, essentially those 2 months, we did provide emergency services by our faculty. Our faculty stepped to the plate, and so all of our patients who required emergency services were taken care of. You may know that the governor actually suspended all elective dental care beginning in March. It was March 16th, actually, and he did that until June 1st. That was also the recommendation of the American Dental Association across the country. But on June 1st, he allowed now the beginnings of elective dental procedures, just like he started the allowance of elective surgical procedures, and our clinics began to open up slowly. All of our academic courses remained online and are still essentially online. Our simulation laboratory, in which dental students learn the beginnings of providing dental care and preparing teeth and those sorts of procedures that most people are familiar with. The simulation laboratory opened again slowly and still complies with the 50% occupancy that is required by the state of New York. But the student-to-faculty ratio went up because of that, and so our students continued to get the best possible education available. Our clinics, as I said, opened slowly, but now we are back, and by the beginning of September, the middle of September, we were back to providing the same amount of dental care, and the demand was certainly ramping up, and now is the same as it was pre-COVID. And we expanded our hours, actually, by opening up at 8 o'clock in the morning instead of 9 o'clock, and by opening on Fridays between 8 and 11. So we expanded our hours, increased our clinic time for our students, and the educational process now is better than ever.
That is, great. So hopefully, once the pandemic is over, we'll all be able to, to celebrate. Getting back into technology, do you anticipate additional technology advances that will make dental care even better? What's your vision, say, in the next, number of years?
So I think, yes, I think that technology will continue to improve. The software will continue to get better. It will get easier for dentists and the dental team to use. It will become less expensive, I think, because the technology, as we know, televisions are bigger and better now, but are certainly less expensive than they were just 6 to 10 years ago. So I think that will make it easier to get that technology out further into the dental community. Also, the idea of the technology allowing dentists to do some of the laboratory procedures within their office, because they will have machinery that will be able to produce crowns and bridges and that in their office. The software will enable them to design prostheses more accurately and also to design surgical procedures, and as I mentioned before, the fabrication of surgical guides to actually make the surgery safer and more efficient.
The other question I have is, during the pandemic, a lot of people postponed dental care. And do you feel that there's going to be a crisis of dental health because so many people haven't been going to dental offices, even though they've taken precautions?
So in the dental community, I think, has seen an uptick now that people are coming back to offices in preventive care. In other words, there are more hygiene appointments and things like that. Apparently, there may be more cosmetic services being asked for because people are looking at themselves on Zoom a lot, and that entices them for cosmetic procedures. I think that there will be and continue to be, at least in the short term, an increased demand, eventually, obviously, evening out over the course of time. There has been some literature written about fracturing teeth because of people stress levels being up. But again, I don't know the literature well enough to say that's factual, other than I've heard that.
Great. Well, we're running out of time and only have about a minute left, and just want to know if there's anything that we didn't cover that you'd like to bring up.
Well, I personally thank you for the opportunity to talking to the community. I think it's important for the community to know that the Touro College of Dental Medicine is there for them. Please take advantage, and we're more than happy to come to the community and get the idea of oral health education out there to maybe entice other people to get into the field.
And I, just want to also commend you. I've dealt with your staff, and you have very, hardworking and passionate, employees and representatives who really work hard to spread the word about many of the great things that are happening at Touro College of Dental Medicine. They really make an effort to reach out, to the community. So you should be really very proud of your staff, and it's nice when there's dedicated people working for any organization.
Well, I truly appreciate that, and you couldn't say it any better. Well, I'm very, very thankful for our faculty, staff, and our students. They are hardworking, dedicated individuals who make us all proud.
Great. Well, thank you very much for joining us. I'm Paul Feiner, and I'm the Greenberg Town Supervisor. I thought this was a really interesting, program. And again, best of luck to you and your college.
Thank you so much. Take care.
Great. I'm Paul Feiner. Speak to everybody next week.